Okay, so for my presentation, I chose the Beck's Depression Inventory. Um, the reason why I chose the Beck's Depression Inventory was because my chosen population has depression as a comorbid disorder. But in addition to that, the clinical placement where I work, a majority of the clients have depression as their primary diagnosis. So I wish to get better at um, using the depression inventory to better help these clients. And I also wish to get better at detecting depression. So for the psychometric information, the Beck's Depression Inventory 2, which is BDI 2, can be used with clients as young as 13 years of age. The BDI 2 includes 21 items that describe symptoms of depression of an affective cognitive, behavioral, or physiological nature. Each question is on a 4-point scale severity, which is goes from 0 to 3, 0 being the least, 3 being the most. Um, and something that is important to note is in our textbook, it says that the inventory is to be used in the time frame of the past 2 weeks, including the day that it is taken. And then for the reliability of the inventory ranges from 0.73 to 0.92 with a mean of 0.86. And then the validity is high, which is for the questionnaire, which is 0.92. The validity for this questionnaire is very high because it uses the DSM-4 criteria for its questions. And then for background, it underwent a revision in 1978, the BDI-IA, and then 1998 and the BDI-2. A shorter version of the questionnaire, the Beck's Depression Inventory BDI, fast screening for medical patients. It's available for primary care use. This is the one that you'll usually see when you see your doctor for quick visits. They'll give it to you at the beginning, um, just for like that quick screening to see if you need additional services. There's also the Children's Depression Inventory, too. It's a self-reported measure for children and adolescents ages 7 to 17. Um, it's a 28 questionnaire at a third grade reading level. So for the strengths and weaknesses, um, the questions are very like clear and concise, user friendly. The clients are able to do the questionnaire on their own. It has good reliability across languages because it has been forgot the word translated, has been translated into many languages. Um, and then it also has flexible application in different settings because of the short version and then the version for children. Um, and then the weaknesses is that it's easy to fake responses because of the very clear and direct wording. Um, the measure is very clear as to what it's measuring. So if the client or patient doesn't wish to be forthcoming of how they're feeling, or they could easily mark themselves as low or higher on the scale. Um, and then the the Beck's depression scale inventory uses this DSM-4 and not the DSM-5, and it also is copyrighted, so it needs to be you need to purchase a license for use. And then another weakness that it has is that if somebody has a like physical illness that is maybe causing them pain or drowsiness, it can increase their score in the inventory. And then for an overview, um, just to give an example of some of the questions, for question 1, I just put the lowest score and the highest score. So 0 being I do not feel sad, 3 being I am so sad and unhappy that I can't stand it. So you can see with this question of how clear it is, how a client, if they didn't wish to be viewed on one side or the other, how they could easily circle um, if they wanted to, fake the results. For question 2, 0 is I am not particularly discouraged about the future. 3 is I feel the future is hopeless and that things cannot improve. Question 6 is 0. I don't feel I am being punished. 3, I feel I'm being punished. So you see how direct those questions are, and there's not a lot of room for interpretation. So I attached the whole questionnaire to this PowerPoint. Um, you can see the questions that I put up. Um, and then if you guys wish to, see this later, you can. I wasn't sure if I was supposed to read through all the questions, but they're here. So for the scoring system, you add, so depending if the client circled 0, 1, 2, or 3, you will add up that number. So if they scored a 3, you will add up the number 3. So it will be 3. Um, and then if they scored 1, it will be 1. If it was 0, you won't add that number. So for example, if number 1 was a score of 3 and number 2 was a score of 1, the total for those two answers would be 4. And then the range, after scoring all those, you compare it to the range, and that the range at the end is 1 to 10 is normal, 11 to 16 is mild mood disturbance, 17 to 20 is borderline clinical depression, 21 to 30 is moderate depression, 31 to 40 is severe depression, over 40 is extreme depression. And then according to our textbook, it says, as a general rule, if the score exceeds 28, especially for 2 administrations of this inventory separated by 2 weeks, the counselor should consider referring the client for psychiatric evaluation and possible medication. All right. I feel like crying. Okay. So I'm gonna give you the Beck's depression inventory today. Um, this is just like a questionnaire. It has a 0 to 3 scale and it has a description of each number of what that is. So like for number 1, it's I do not feel sad. And then for the 0 score, and then for 3, it's I am so sad and unhappy that I can't stand it. So that's just an example of that. This is a self-scored scale, so you'll be doing this on your own. Um, I can, and then at the end, I will tally up the score, and then we can review the results at the end. Do you have any questions?
No.
Okay. If you have any questions during any of this or any of the questions are confusing, you can always ask me.
Okay.
All right. Okay. Okay. Okay, so I tallied up your score and it's a 19. And the 19, it's borderline clinical depression, which is just it's like like you have like a light depression. Um, do you have any like I guess areas of more concern for you that are affecting you the most? If you like to look at the questions.
No. I mean, I try to answer it as honestly as possible. So,
Okay. All right. For any reason, if there's anything like in particular that is like bothering you, we can always like focus on those specific challenges for you um during therapy, you know. Right. And for explanation results to treatment team. So Mr. Luis. So I went over the scoring with the client and it looks like they're kind of on the high end of the borderline clinical depression. So they're almost scoring on the moderate depression side. The client didn't um, mention when asked if they had any specific areas of concern, they said no. Um, but I did let them know if there was like anything further that they wanted to like explore that we could do that during like therapy since they did score that 19. It does look like that depression is there, but yeah.
interesting.
All right.
Wait, don't you need to do the
Right. Something that I want to add is that since the client didn't um you know say that there was anything of particular interest or concern, um what I would do is look at whatever they scored highest on, and those would be the things I would focus on um during therapy. And then if they brought up anything of concern, I would add that to their treatment plan. Uh, so thank you everybody for listening. Happy President's Day. Do some self-care.